Pharmaceutical practice is the direct or indirect provision of drug therapy for the purpose of achieving the elimination or reduction of patient's symptoms, arresting or slowing of a disease process, or preventing a disease. The mission of the pharmacist is therefore to provide pharmaceutical care to the public. Since pharmaceutical care centers on the provision of medication-related care for the purpose of achieving definite outcomes that improve a patient's quality of life, it goes without saying that this profession is one that is delicate and can make or mar a nation. The Pharmaceutical Society of Nigeria is the umbrella body of pharmacists in Nigeria and seeks to maintain a high standard of professional ethics and discipline among its members in order to ensure the well-being of Nigerians. Nigeria today imports most of her pharmaceutical products from outside the country, while monitoring the practice of pharmacy has also become a big challenge. On Nigeria Today, we shall take a look at the practice of pharmacy in the Nigerian health sector. I am Segun Ojelade. I'm being joined to discuss the topic, the practice of pharmacy in Nigeria healthcare delivery system, by the National President of the Pharmaceutical Society of Nigeria, Ahmed Ibrahim Yakasai. I welcome you to the program, Mr. President.
You're welcome, Mr. Sheikh.
Yeah. On his left is another pharmacist. He is the immediate past chairman of the Pharmaceutical Society of Nigeria, Abuja branch. He is Atume Superior Ode Joto. I welcome you to the program.
Thank you very much.
Now, Alhaji Yakasai, we're talking the practice of pharmacy in Nigeria. Let's begin from the nature of the practice of pharmacy in Nigeria today. Where are we?
Yes, when you talk of direct or indirect practice, I see it in a different perspective. We say direct or non-direct related issue as far as the practice is concerned. Pharmacy practice is not Nigerian practice in isolation. It has global trend of the whole issues, be it the issue of the products, and now is pharmacocentric approach of doing things as far as the practice is concerned. And pharmacists generally, we look at ensuring quality of pharmaceutical products, be it from the production, importation, exportation, and distribution. All these angles, you have to bring them to bear in the practice. And then indeed, you have to look at the management of procurement system, the aspect of quality in that system, and indeed, how do you advise other healthcare professionals? How do you talk to the patients? What is there that you can really bring about maximizing the outcomes, healthcare outcomes? How do you contribute in improving the healthcare delivery system generally? All this come together to give you the holistic approach as far as practice is concerned. Yes, the issue of practice in the whole Nigeria, as far as we are concerned, you have to go about the drug distribution, which is so chaotic, uncoordinated, no doubt about it. We have been talking about national drug distribution guidelines, that it should be implemented. It is there, even though the Pharmacists Council of Nigeria, which is the regulatory agency of the Federal Minister of Health, just issued a press release of recent that by 2017 they want to see all the coordinated system start operating, implementing, so that possibly the marketplaces, which is not authorized to sell medicine, are closed. We have the issue of mega distribution, state distributors, wholesale distributors, coordinated wholesale distributors, and so on. Then there is the issue of National Health Act, which we believe it will really come a long way to sanitize the practice, especially when it is coming with a framework on the management of healthcare system, the development, and indeed even the design, so that we can be able to achieve the target of MDG, which I have not achieved.
Okay.
We're talking of SDDG now.
Yes, SDG now, yes.
So we're talking of how do we now sanitize the illegal operations, especially the practitioners who are not the quacks.
Okay.
You know,
we come to some of the issues that you have raised on the program. Mr. Atume,
yes.
Let me allow you to make your own opening comment too on the practice of pharmacy today. In terms of number, if you cannot give me the figure of this is the number of pharmacists, qualified pharmacists that we have in the country, but do we have adequacy of professionals in this area?
Well, in terms of the number of pharmacists servicing the Nigerian populace, I can tell you that we don't have adequate number, because we have over 10,000 pharmacists, but those that are registered, that are residents in Nigeria, are far less, and those that are practicing the profession as well are far less. We have those of us that are in diaspora and all that. So in terms of number, we really don't have the number yet, but we realize that, of course, the Pharmacists Council of Nigeria, along with National Universities Commission, they are accrediting more and more pharmacy schools so that we can produce more pharmacists, qualified pharmacists, to be able to deliver pharmaceutical care and services to the Nigerian people. So we'll get there.
Now, you raised, Alhaji Jakasa, you raised a number of issues during your opening comments, and I want us to move very fast on some of them. You said the National Drug Distribution Network is chaotic.
The distribution channel is
chaotic.
Yes.
What exactly do you mean, and how is that impinging negatively on healthcare delivery?
You see, let me go back to what you were asking. Yes, as at now, we have about 20,000 pharmacists on the ground. But to be honest, 30% of the population of pharmacists are in Lagos alone. 30% are in Lagos. And the ratio by World Health Organization is that one pharmacist should be able to service at least 2,000 people. But as at now, it's 1 to 12,000. Just like the doctor ratio is supposed to be 1 to 600, and we have about 1 to 1,618 doctors. So the issue of drug distribution,
yes,
everybody who has no business in drug business or in drug activities believe there is money. Our own is not commercial. We think of the patient. We are central to the healthcare. Generally, healthcare delivery system, pharmacies are not only for selling. That is why we say we shouldn't treat drugs as article of trade. But where somebody who doesn't know anything is involved, they can buy anyhow, they can sell anyhow. That is where the issue of picking and counterfeiting is involved.
Now, who do you blame for that, and how can we check that?
Yes, we said the regulations, the policy, the nature of the punishment must be punitive. We must enforce. We must show that, yes, we are really for serving humanity. The government must be involved as far as enforcing the laws and regulations are concerned. Funding of the system must be given to the regulatory agency, because if the cartel has more money than the regulatory agency,
It's a problem.
It's a serious problem. But if then the issue of corruption, if somebody who is supposed to impose is taking peanuts, is ready to compromise, it's a problem. So definitely we just have to have that fear of God and ready to see that, yes,
this issue of those who have no business in the drug business getting involved and even playing a major role, it's a very serious problem. We've heard of cases of some unscrupulous Nigerians going abroad to countries like China and India, tell them to lower the quality of the drug. We'll bring it into Nigeria and they begin to sell it. It's a regulatory problem. PSN, Pharmaceutical Society of Nigeria, is there anything at all that you are doing from your own end to assist the authority to get to the root of this problem?
Of course, that is part of our objectives, aim and objectives, to partner with the government, all the agencies concerned. And I can tell you, Pharmaceutical Society of Nigeria is behind establishment of NAFDAC, PCN, we are involved, and even National Institute for Pharmaceutical Research and Development, and any others. And we are a pressure group, we are a lobby group, we write position papers, we submit, we reach out, we advocate, we network to make sure, yes, we create this awareness. We show the consequences, the problems attached to this, and we even proper solutions. How do we go about it? But of course, everybody must be involved.
Mr. Kumi, in various communities these days, you see some malams or old women, you know, carrying bags about all sorts of drugs are there. They cure whatever ailment. They even go to my grandma in the village and sell all kinds of drugs to her. Why do we have that problem? Is it failure of regulation? Is it poverty? Is it ignorance? And how can we curtail such bad situation?
You see, the challenge really is regulation. You know, for the communities and for pharmacists, the pharmacist is a specialist that is trained to handle medication and drugs and to be able to counsel the patient. And you find that the pharmacist is the only professional that the patient comes last with before, to get his or her medication, so as to enable the pharmacist counsel the patient on how to use such medications to have maximum effect. You know, but what we're having is that, just like my president has said, people see drugs as articles of trade and they feel there's a lot of profit in it, and therefore they just go into it. But like I said, the Pharmacist Council of Nigeria is a regulatory body, and therefore they need to be empowered financially and otherwise with stringent laws, so that whoever runs foul of the law can be penalized for it. Right now, the Pharmacist Council of Nigeria, they are doing their utmost best, but like I said, they need to be funded properly, because if you look at this country, it's a vast country, and a lot of places need to be covered. So for the community pharmacists, those are the pharmacists that are registered and licensed, that own pharmacies in various communities in this country. You know, so
you say pharmacies. We have pharmacy stores. We have patient medicine stores. Those ones, who regulates them?
The Pharmacist Council of Nigeria is the regulatory body that is authorized to regulate them. But what we're having a situation in this country where everybody wants to sell medicines without due regard to the law. And so you find a situation whereby in a particular street or community, somebody just wakes up and sees a shop and says, oh, I can begin to sell drugs, just like cosmetics and provisions. And that's a major challenge without recourse to the law. You know, for community pharmacists, a pharmacist would follow due process. If he sees a place that is suitable for a pharmacy, he writes an application to the regulatory body, the Pharmacist Council of Nigeria. They come to inspect it, and if it is good enough for a pharmacy, they give approval, and that pharmacist is licensed as well as the premises.
Who regulates patent medicine dealers?
The Pharmacist Council regulates patent medicine dealers. But unfortunately, what is happening in this country is that they just open anyhow without due regard to the law, unlike pharmacists that want to follow due process. So that is the challenge.
The PSN does not have capacity to monitor all of them.
Well, just like my president said, the PSN is a pressure group. We are enlightening the public and tell them, look, the only place you can source your medication and you're sure of what you're taking is the pharmacy. It's the pharmacy, and we have an emblem with an ROS sign indicating that whatever you get there, yes, a registered pharmacy, and the drugs can be vouched for.
The program is Nigeria Today. We are taking a look at the practice of pharmacy in Nigeria. I have the president of the Pharmaceutical Society of Nigeria in the house and the past president of the Abuja branch of the society. We'll take a short break now. We'll be right back. Welcome back. The program Nigeria Today continue. We're taking a look at the practice of pharmacy in Nigeria healthcare delivery system. I still have the